वेलकम वन एंड ऑल, सभी को नमस्ते। नमस्ते डॉक्टर अखिलेश भैया, हाउ आर यू?
नमस्ते भैया।
जी नमस्ते। सो आई वेलकम यू ऑल एंड वेलकम डॉक्टर अखिलेश भैया विद अस। सो अखिलेश भैया, व्हाट वी आर गोइंग टू डिस्कस टुडे?
Today, Pia, we will discuss about the allergic rhinitis.
यस, नाइस नाइस। सो ओवर टू यू भैया, वेलकम, नमस्ते।
जी। Pia, may I know if the slide is visible to you all and my voice is clear?
जी भैया, स्लाइड इज वाज देयर, इट जस्ट वैनिश्ड अगेन।
1 minute.
जी जी भैया, नाउ ओके।
Now visible, Pia? जी. And whether my voice is clear, Pia, to you all?
जी, वॉइस इज आल्सो ओके जी।
Okay, Pia. So once again, welcome to all the members in this health session. And in today's health session, we will discuss about the allergic rhinitis and its prevention and management. Allergic rhinitis is one of the very common condition, and many people will be suffering from a very long time, and they will be taking some medicine, some antihistamines or some decongestant or sometimes some steroids, and they are lacking some of the very basic idea by which they can manage it very well, or they can prevent from this suffering from this condition. So we will discuss in detail about what are the causative factor, what is this condition, what are the causative factors, how we can prevent it, and if someone is suffering from that, so how effectively we can manage it. So what is allergy? Allergy, sometimes we also referred it as hypersensitivity. So in general language also we say that person is sensitive to that some particular some particular things, or some smoky environment, or sometimes some clothes or medicines like this. So we say that person is very sensitive. So allergy is also referred as hypersensitivity, and an allergy is a exaggerated reaction of our immune system to foreign substances also called as allergens, that does not bother or harmless in most of the people. So we see that one person, maybe his immune system may be reacting in a very hyper manner, and because of this, the person will have severe many of the symptoms, like sometimes he will be having severe sneezing, repeated sneezing, sometimes some skin eruptions, or many times we see that conjunctivitis or redness of the eyes or watering from the eyes. But in the same in our environment, or in the exposure of same allergens, many of the people will be very comfortable. They will not be suffering with any of the symptoms. They will be comfortable. But maybe one person or maybe two-person in a group having this kind of problem. So that particular condition, which is normal or harmless for many of the people, but in some of the people, their immune system is showing some exaggerated reaction, that is the condition we called as allergy. So what are the common allergens? So like the pollens or house dust. So many of the people, when they broom the room, or they will clean the dust in the room or house, they start sneezing. There will be secretions from the nose or the redness of the eyes. Such conditions we will see. and exposure to the pets and farm animals. So some of the people, if they have some animal in pets in the homes like dogs, cats, all this, or if they have this cow shed, so going to that area or coming in contact with these animals or pets, they will start showing some allergic symptoms, or their immune system will respond in a very hyper manner. Some of the people will be having some food allergy. So uh, we commonly see such kind of condition, like one person, he will take some vegetable and he will suddenly develop some allergic problems. And some of the people, they are allergic to medications. So that also we see that a particular brand or a particular medicine for like antibiotic, etc., many of the people will comfortable and they will find relief from that medicine, but one or two people may be allergic to it, or contact allergens, the metals, fragrance, even the fragrance, like some of the people, they will not be able to tolerate some of the fragrance, some of the particular smell. They will start feeling very difficult or sometimes suffocating, or running nose, or they may be having headache, these kind of symptoms coming in contact with some particular fragrance. And the venom in insect stings and bites. So in a few of the people, you will see, even if the mosquito bite, there will be very big eruption or very big patch in their skin, or some of the wasp bite, or these kind of some mosquito, or the flies, or wasp, these kind of things, they will develop very huge symptom, very severe problems. So such kind of things we also see. So these all are the common allergens, and there may be many more. It's not only limited to this. Some of the people, they are allergic to one particular kind of cloth material, so that also we see. Then this is about the allergy. Then the another word is rhinitis. So what is rhinitis? Inflammation of the mucous membrane of the nose. You know that our nose is having mucous membrane. It is lined by the mucous membrane. So the common symptoms of this allergic rhinitis or the rhinitis is rhinorrhea. Rhinorrhea means there will be nasal secretions, nasal congestion, itching and sneezing. The person will repeatedly sneeze. He will be having irritation, and because of the irritation, there will be itching, nasal congestion, and secretions from the nose. So this is the common symptoms. These are the common symptoms we see in case of rhinitis. So the allergic rhinitis is caused by some allergic reaction. So we have just seen what are the common allergens, and many of the people, when they are exposed to these allergens, they will develop rhinitis. So that condition we say as allergic rhinitis. So allergic rhinitis is an atopic disease characterized by symptoms of nasal congestion, clear rhinorrhea, sneezing, post-nasal drip, and nasal pruritus. So post-nasal drip means the posterior side of our nose. From there will be secretions, so that will come in our mouth. So you may have experienced it. Whenever you have a running nose, that secretion will come from the posterior side of the your nose, and it will come to the mouth also. So these kind of symptomatology we see when the person is having allergic rhinitis, and when he is exposed to the allergens for him or her is sensitive to. So it affects 1 in 6 individual and is associated with significant morbidity, loss of productivity, and healthcare costs. So it may not be life threatening. but the person will lose his productivity. He will not be able to perform his normal activities, or if he is performing also, he will feel lot of difficulties because of the repeated sneezing or because of the continuous secretions from the nose, or pruritus or itching sensation. So because of all those things, he will lose his productivity. And again, many of the people will find they will take medicines for months together, or sometimes from years together. They will be continuously taking some kind of medicines to control this problem. So there is a involvement of healthcare costs also with this condition. And allergic rhinitis is a common disorder that is strongly linked to asthma and conjunctivitis. So it is allergic rhinitis may look just a condition of our nasal cavity, but many of the cases we will find that it is associated with asthma or conjunctivitis. So conjunctivitis will find redness, irritation, secretions from the eyes, and in asthma, the person will be having suffocating uh, feeling, and he will find it very difficulty in breathing. So there will be dyspnea. So whenever the person is exposed to some allergen, so suddenly he will find severe breathing difficulty. Or allergic rhinitis may also be associated with the conjunctivitis. That means whenever person is exposed to these allergens, he will be having these, along with rhinitis, he will be having the redness of the eyes, burning sensation, secretion from the eyes, pain, all those symptoms. Coming to the prevalence of allergic rhinitis. So allergic rhinitis is the most common type of chronic rhinitis, affecting 10 to 20% of the population. So you can imagine in a country like India, where we have population of 130 crore, and if 10 or 20% people will be suffering with this condition, how huge the health cost is involved in this, and how frequent this condition is in the medical setup. So it's a very common problem, and many of the people, they will be suffering from years, from sometimes from 10 years, 20 years, they will be suffering from these conditions. So evidences suggest that the prevalence of allergic rhinitis is goes on increasing. So that means gradually the condition is becoming more and more prevalent in the society. More and more people are becoming allergic, and they are becoming hypersensitive to some of the allergens. Coming to the classification of allergic rhinitis. So the first classification is based on the time of occurrence. So seasonal and perennial. Seasonal allergic rhinitis will be seen mostly when there is a transitional period of the season. Like at present, the summer, and this summer is almost end, and now it is rainy season. So this transition period, this is a very favorable condition, and many of the people, they will suffer with the allergic rhinitis in such kind of transitional period of seasons. So that kind of, and once after some times when this transitional period happen, they will become normal and they will be able to do their routine work. And perennial, so occurs throughout the year. That means throughout the year they will be suffering with this allergic rhinitis. So this is the classification based on the time of occurrence. Then based on the duration of the symptom. So intermittent and persistent. So intermittent, we say when less than 4 days per week or less than 4 consecutive weeks. So that type of when the symptom is less than 4 days per week or less than 4 consecutive weeks. So that kind of allergic rhinitis we say as intermittent allergic rhinitis. And persistent allergic rhinitis, when the symptoms are present more than 4 days per week and more than 4 consecutive weeks. That means for more than a month, the person is suffering with this problem. So that is, we say as persistent allergic rhinitis. Based on the symptoms, again, the allergic rhinitis is classified in three categories: mild, moderate, and severe. So mild, as the name itself suggests, so when the symptoms are very minimum and the person is able to perform his daily routine, he is able to sleep without much problem. So that kind of uh, situation is mild allergic rhinitis. Moderate and severe is when the person is not able to perform his daily routine, his sleep is also affected, and there is a multiple symptoms which is making which make the person suffers. So that kind of condition we take as moderate, or if the person is very he's not at all able to perform his daily routine and he is completely suffering with loss of sleep, that kind of condition we say as the severe allergic rhinitis. So based on the symptomatology, the condition is categorized into three categories: mild, moderate, and severe. So what are the risk factors for allergic rhinitis? So the pollens like the trees, grass, and weed, including ragweed. So exposure to these kind of plants, etc., that person will develop allergic rhinitis. So these are the risk factors. And molds and indoor allergens, house dust, mites, and animal allergens, etc. So like the if we have cat, dogs, pets in our home, so coming in contact with them, that may be a risk factor for allergic person. And having a large geographical variability within and between countries. So a person working in one place suddenly shifting to another place where the environment is completely different. So the climate condition where he was working, he is adjusted to that condition. Suddenly he has to make a shift, and when he is going to new place, this place is completely new and he is unable to adjust with this new weather. So that kind of geographical change or change in one country to another country, suddenly everything will change. The vegetation and the environment, the weather condition, everything will change, and the person may suffer with this problem. So this is a risk factor for allergic rhinitis. Exposure to farm animals, maybe cow or maybe horse, etc., which are there in the farm. So these exposure to these animals or where they are living that farm, so that is also a risk factor. And maternal and paternal smoking, not only maternal and paternal, but even the workplace where many of the people they are smoking, or the person where he's the taking food or etc., where he's working workplace or his lunch room, etc., where the many of the people they are habituated of smoking. So this may also be one of the risk factor for the allergic rhinitis. And the air pollution, so we can see the condition of Delhi and other repeatedly it is coming in the news. So if there is air pollution, so that will also be one of the risk factor for allergic rhinitis. So how to understand this condition? How to know that the person is suffering with the allergic rhinitis? Because it may not be always the allergic rhinitis. There are many other conditions which mimics to this allergic rhinitis. So how to know that this particular condition is because of some allergens, or the person is suffering with allergic rhinitis? So one is thorough history. This is a very important part of understanding the person is having allergic rhinitis. So in the history, we have to very carefully take all the details, all the important details, like his residence, his workplace, his home, office, his school. So as just we discussed about, if the environment where the person are smoking, or there is air pollution, or the school or the home where he is staying is near to some factory or some other manufacturing unit from where the pollution is coming. So these all things gives us idea that person is exposed to these all allergens. Then environmental history, we have to ask what is the weather condition, what a kind of vegetation is there. Then drug history. So if many of the people, they may have sometime experienced, or they may have seen that taking one particular drug, suddenly the person is developed some skin eruptions, or some breathing difficulty, or some other sneezing, or redness of the eyes, this kind of conditions. So we have to, when the person is seen suffering with uh, these symptoms, we have to take a drug history, whether he has taken consumed some drug recently. And detailed history is needed to know the potential allergens such as humidity level in home, office, tobacco, smoke, furred animal, etc. So like the people, those who are staying near to some ponds, or near to some river, bank of the river, in such kind of situation, so we have to see whether what is the humidity level, and whether this is creating this problem. So that all we have to inquire, whether there are pets in the home, or whether the person is having some animal house there, he is having cow, etc. So these all things, or even the neighbor's house. So that all things we have to inquire. Whether the person where he is staying near to that, any dairy is there. So all those details we have to take in from the person who is suffering with, probably with allergic rhinitis. Then in the examination, we have to see, just by inspection, we will know that the person is taking mouth breathing because of the nasal congestion. He will unable to take free breathing. So he will be taking mouth breathing. Then there will be a lot of irritation. So continuously rubbing of the nose, and there will be frequent sniffling and throat clearing. So again, there will be throat clearing by the person. In the nose, we will find that the person is having some slow swelling, and sometimes when the condition is bit severe, there may be bleeding also. Then pale and thin secretion. So the person will be having nasal secretion, which will be pale or thin, just watery discharge. And polyps may also be seen. Polyps means a small eruption inside the nasal cavity. So that may also be seen. So some of the people who are continuously exposed to some of the allergens, so these allergens may create the polyp inside the nose. So again, development of this polyp will again create lot of difficulty in breathing. So person will not be able to take free breathing because of this emergence of the polyp. So that also it can be seen easily. In the mouth, we'll see that in large tonsils and post-nasal discharge, and the eyes, there will be allergic shiner. So this means there is a dark area under the eyes. So the person who is suffering with allergic rhinitis, so in that person we will see this allergic shiner. Then conjunctivitis, we have discussed that many a times, this allergic rhinitis is associated with conjunctivitis. So, and some of the people, even they will suffer with the asthma, and whenever they will be exposed, they will be having severe breathing difficulty also. Then sinuses, there are paranasal sinuses. If the side of the nose, if you will just little bit, you will touch, slight pressing, the person will be having tenderness, he will be having pain. So, and allergic or atopic disease like eczema. So this may also be seen that the person who is suffering with allergic rhinitis, he will be having some skin eruptions also. So there will be patches over the skin because of the exposure to some kind of allergens. Sometimes it may be because of the cloth, sometimes it may be because of touching some kind of metal or coming to some pollutant environment, the person, or sometimes because of the food allergy, suddenly the person will develop allergic symptoms of the skin, eruptions of some reddish patches over the skin. And with this, the person may also be having the allergic rhinitis. Then allergic or atopic disease. So we may see that the person is having asthma, and this asthma is triggered by exposure to some kind of allergens. So these all things we have to very carefully, we have to take history, and then when we find some kind of clue from this history, asking each and every detail, then we have to see how much the person is affected because of this condition, whether there are nasal polyp, whether there are some asthmatic condition or some skin allergy. We have to see his eyes also, his or her eyes also, whether some there are dark lining or the eye shiners, or we have to see some conjunctivitis kind of symptoms. So these all things we have to very carefully see. Coming to the preventive aspect of this allergic rhinitis, how one can prevent from this condition. So education of patients, and if the sufferer is a children, sufferer is a child, then we have to give education to the caregiver or the parents. So we have to properly educate that after taking history, when we have some clue, then we have to properly educate that these are the conditions which are creating allergic rhinitis. And the best thing is by avoiding triggering factors that cause allergies. So if we are able to pinpoint that these are the problems, or this particular allergen is creating this issue, maybe presence of pets, or maybe because of the polluted environment, or maybe the smoking of the parents, or smoking of some person in the home or working environment. So those all things we have to very carefully understand, and then we have to, the best thing is we have to avoid that triggering factor. Sometimes it may be food also. So if some food is creating this allergic condition, we have to avoid that food, so we will not be suffering with this problem. Then use of mouth nose mask to avoid allergens. So this is now many of the people, because of this COVID situation, they started using this mask. So this mask is also very good to avoid allergens. So like polluted environment, dusty, smoky environment, or when we are cleaning our house, because of the exposure to the dust, the person may suffer with this allergic problem. So the mask is a very simple, and even if the mask is not available, we can, a clean cloth also we can use, or the kerchief also we can use to cover our nose and mouth. So these are, we can avoid exposure to these allergens. Then Neti Kriya. In the yoga sessions, we have discussed about the Neti Kriya, so nasal irrigation. So that is very effective in preventing of this allergic rhinitis. Then in our health session in the daily regimen part, we have discussed about the Nasya Karma. So that is nasal installation of oil. So putting 2 to 3 drops of oil in each nostril just after the brush. So this will create a barrier which will not allow the allergens to penetrate the mucous membrane. So when these allergens, because when we are putting this oil, it will create a barrier, it will create a covering. So anything which is causing allergy, allergic rhinitis, will not immediately penetrate the mucous membrane. So the person will not suffer with allergy. So this use of this Nasya Karma, or putting few drops of oil, 2 to 3 drops of oil in each nostril after the brush, that is very good habit. And even if the person is suffering, this will help to minimize the condition. Then we have to be very careful during the Ritu Sandhi. Ritu Sandhi means when one season is towards the end and the next season is starting. In this particular phase, especially the last 1 week of ongoing season and the first week of coming season, these 14-15 days we have to be very careful about our food habits and about our activities. So that will, through this we can easily prevent our allergic conditions. Then avoiding overeating and over drinking. So whenever there is a transitional period, or whenever we are having this kind of condition, so we should take only limited diet, and we should follow some diet restrictions also. So, and even we should not have excess of drinking of even water also. So that may also cause, or that may also become aggravating factor along with these allergens to create this allergic rhinitis. So we have to be very careful, and we have to do some calorie restriction whenever the person is having this allergic situations. So by this we can avoid. So massage of the lower extremities. So we have discussed in our daily regimen part about the Pada Abhyanga. So whenever we are going for full body massage, we have to specifically do the massage in our lower limbs also. So lower extremities massage with simple til oil or the coconut oil, that will also help to avoid this allergic, or to minimize this allergic situation. Then avoid sleeping in prone position. So the person who is sleeping in prone position, that may also trigger this factor, this condition. So we have to sleep in supine position. So that is the best way. If we are sleeping in prone position, the one thing is, sleeping in prone position sometimes creates breathing difficulty. And if the person is having bit sensitive to some of the allergens, so that may again worse the condition. So sleeping in prone position is not advisable, or it should be avoided by the person who is allergens to some of the things. So by this he can avoid occurring of emergence of this situation. Then maintaining healthy sleep time. So many a times you will find the person who is allergic to some of the things, some of the allergens, he will be having a irregular sleep pattern. So sleep is very essential to keep our health in optimum level. So proper sleep is very helpful. So a timely sleep in proper time, so like especially between 10 to 5, this is the best time in the night. So that is required to avoid this allergic condition. Avoiding exposure to the head to cold air and taking a shower early in the morning. So uh, some of the person, they are easily suffering with this allergic condition. To avoid this, they should also be a bit careful that early mornings they should not have cold water bath, or they should not directly go out in the cold or in the uh, cold air, exposed to the cold air. So these things, if they are a bit aware, so they can easily avoid this allergic rhinitis. Then what are the simple remedies which we can use in our home to manage this condition? So one simple medicine which is very easily available is Triphala. So Triphala churn, Triphala powder, that we can make decoction. Decoction means simply like we are making tea. In the similar manner, we can take 1 spoon of Triphala powder, 4 cup of water, boil it in mild heat and reduce it to 1 cup, filter and take it. So it will be nearly 30 to 40 ml we can take in empty stomach. So that will help to minimize these symptoms. Then some of the very other easy home remedies is Tulsi leaf juice. So 3 to 5 ml, almost 1 spoon of this Tulsi leaf juice with 1 spoon of honey, we can mix and we can take. So this is very commonly used in home also. The person who is having some rhinitis or he's having uh, nasal secretion. So Tulsi plant leaf is commonly used in most of the Indian homes. Then ginger juice, that is also ginger is easily available in our kitchen. So we can take just 1 inch of ginger, crush it, take the juice, nearly 1 spoon, mix it with 1 spoon of honey and take it. So 2 times, or if the condition is a bit severe, bit troublesome, 3 times also we can take these medicines. Like Triphala decoction, we can take 2 times, or even if the condition is more troublesome, we can take it for 3 times also. Similarly, the Tulsi leaf juice and ginger juice also. Then ginger juice, uh, 5 ml with turmeric powder, half a spoon. We can mix with warm water, or we can even make a decoction from this. So we can crush nearly 1 inch of ginger and half a spoon of turmeric powder. We can boil in 4 cup of water, reduce it to 1 cup, and that you can drink like herbal tea. So that will also very helpful uh, to cure this condition. Then this black pepper, which we say as kali mirch. So that black pepper, but that require very little quantity, just 1 pinch about. So 250 mg to 500 mg with honey. Or if you are giving to the children, you should be more careful. Take a very little quantity, because if you are taking more quantity of this black pepper, again it will cause lot of irritation. It is having very hot nature, so it will cause burning sensation, etc. So better to take a very little quantity of it. Just 1 pinch will be enough. So you can mix with honey and you can take it. So this nasal secretion or the post nasal drip, this all will be solved, or you will get a lot of relief from this. Nasal congestion will be relieved immediately. So black pepper powder 500 mg with ghee and sugar candy. So that combination also you can make, and this will help to reduce this allergic rhinitis. There are few researches also, some publications about how this simple medicine Triphala is helpful in allergic rhinitis. Then we should also be aware that when we have to approach to a specialist or to nearby physician. So if the condition is long standing, that the person is repeatedly suffering, is suffering from the long time, and it is more than a week he is having this problem. At that condition, you should not go on trying with this home remedies. It is better to go to the doctor take proper remedies, go for the investigation. The doctor is specialized and he will understand your situation better and he will advise the right medications or the right advice which is required. So you should not go on trying with these medicines only and think that uh, these herbal medicine I can take for a long time. So, and the herbal medicines are very slow acting, so it may take more days to get relief from this condition. Don't have that kind of mindset. If the condition is not solved, it is better to visit to the doctor. Then when symptoms is getting worse, suppose you are trying with these home remedies, but the condition is goes on becoming more and more severe, that is the indication that you should approach to the doctor. Then when have asthma and creating breathing trouble, suppose the person is having allergy along with this condition is also associated with the asthma, so you should not goes on trying with these only things and avoid going to the doctor. It is better that you go to the doctor when the person is having asthma, because asthma is very troublesome problem. It is very troublesome. So primary management at home is not useful. Suppose the person is taking 2 to 3 days of these home remedies, but the condition is not at all, he is not at all getting any relief from the condition. So that is also indicating that he should visit to some hospital or to a specialist. Then unable to identify what causing problem. Suppose the symptoms are same like running nose, redness, irritation, all these symptoms are there, but you are not able to find out why this problem is happening to me. That means you are not able to identify what are the allergens or why you have this problem. So that is also the time when you should go to the doctor. Then affecting sleep and normal lifestyle. Suppose the condition is very severe. He, he is not able to perform his daily routine. His sleep is severely disturbed. He is not at all able to sleep. If this is the situation, then it is better to approach to a doctor and don't take this home remedies for granted and goes on trying it for very long time. So these are only when you take it and initially you have good relief, then you can manage with this simple medications or simple home remedies. But suppose if the condition is not solving, not getting relief, and gradually it is becoming more and more worse, so don't think that I can take overdose of these home remedies and I can manage. Or having many of the people, they think that the ayurveda herbal medicines, they will take long time, so I have to take it for 10-15 days, then only it will give the result. So that all is not very correct. Better if we are, our condition is not solved, or anyone in home who is suffering with this is not getting better, then but we have to approach to specialist. So this is about allergic rhinitis. Any participants, if they have any query, they can please ask. See, we still have 15-20 minutes. So anyone, if they want to ask anything more about it or any other topic also, they are welcome to ask.
Namaste, Dr. AICTE-SIP. This is Jaideep. Is it audible?
Ji sir, namaste sir.
Namaste. So it was very useful and informative session. We observed all this in, I observed all this in my life. So from very young age, when I was in 7-8 years, I fell in one water tank. So I drank a lot of water. Then my lungs got so dampness. So 1 month I was hospitalized and took lot of penicillin at that time.
Oh.
So uh, after that I recovered, and then every year when seasonal changes comes, I feel this cold and all. And when I eat jamun, that fruit,
Yeah. This is the season of that fruit.
yeah. So when I eat that, I get cold and then fever like that. But slowly with the age, I got immunity power, and slowly that symptoms get reduced.
Yes.
Um, Now during COVID, when we are using masks, so this kind of dust allergy or something is reduced. That I was able to observe. And when I was affected by passive smoking, I don't like the person who is smoking. I don't go nearby, but sometimes we forced to be there. In that
Yeah.
case also I get allergy. So all this I am able to observe. But slowly my father has prepared this black pepper and dry ginger mixed powder with honey we are taking. That is giving some relief, that we are able to observe also. So
Yes, sir. Yes, sir.
one observation is like my son, when he was 1 year, and he got eczema. So my question is, due to my allergic things, he got that. And also we went to France and we showed there, and we did all the bio that analysis of that skin. We are not able to find the reason, but they said with the age it will go. When he came to 6 7 years, it went off. So, and, but asthma recently, eosinophil count was more 6 months or 1 year back. Then we took to the doctor and he gave some prescriptions. And then inhaler. Now it's not coming, but we had to wait and see for the season whether heat comes back. So I am asking. I got doubt that due to my allergic reaction that continued with him, or that's what I want to ask.
Not necessary, sir, because the kind of causative factors which you told, like the smoking and excess drinking of water, I don't think that these are the same causative factors which are creating some allergic situation to your kid. But there may be other things which, if you observe very carefully, you can identify even. Like in some of the cases, I found that. When usually the small kid, they will urinate frequently and they will defecate frequently, and nowadays we are, previously there was cloth and immediately it was removed, but nowadays they are using these huggies and other things, so which will be kept for a very long time and coming in contact with this humidity. The children's skin will continuously coming in contact with this humid condition, so because of that, the kid will suffer with this some skin allergy. And sometimes when this is neglected, it will even spread to other parts also. So, and again, as I told that sometimes the cloth material, the humidity of the room or the house which is there, so that may also create this skin allergy. So one thing is we have to keep all this cloth etc. in a very hygienic condition. And there are some, if you observe that there is humidity, so there are some instruments also, some air dryer etc. are available. So that can be used. Or some air purifier are there. So these all things we can utilize. But in allergic condition, the most important thing is finding out what particular uh, substance is causing allergy. It may be sometimes this also seen that the people, they will give some kind of metal, some silver or some gold items they will give to the children. They will, so that may also cause some irritation or some may also cause some allergic problem. So very carefully we have to observe what is creating this problem. And definitely, because this is the case of a kid, it is always better to visit a specialist, pediatrician,
Yeah.
who can guide.
When
And even the Ayurveda pediatrician, that also available. So it is good to go show the condition. This is the kind of situation is there. Then uh, the doctor can advise better.
Yeah, when he is 1 year old, we went to the doctor. The doctor
Mhm.
told that it is because of heredity. Some would have previously your family like that. He told.
Mhm.
So due to asthma, he is getting eczema.
Mhm.
You have asthma, so he is getting eczema. He always get under the knees only, within the
Mhm.
foot and the knees. He is to get.
Okay. Huh.
But he is now 10 years old. After
Hmm.
6 7 years, that went off.
Yeah.
But we try to observe what is the factor. I went to many places, Hyderabad, and when we went to France,
Oh.
I showed there. But
Uh-huh.
but that was not aggregated. It was
Okay.
very minute.
Hmm.
We went to all specialists also.
Hmm. Yeah.
So
Yeah.
then we observed that when he takes some kind of food that is
Hmm.
increasing, that we observed, and then we try to avoid that. Now he is
Hmm.
fine. He is fine.
Okay. Okay.
So, and one more thing, due to this holistic health issue, this Friday session, long back, maybe 6 months back, I listened that, that Anutil, that
Anuta, yeah, for
yeah,
nasal
so
installation,
yeah,
2 to 3
that is
drops
working
in
very good.
nose.
That is very working very fine. I
Yes.
suggested to my family members and also my students in the campus. One student, when she take cold water or ice cream, she suffers a lot.
Yeah,
So
very
then
nice
I
to hear this, sir.
suggested,
Very nice, sir. Very encouraging.
that Anutil to her also. She said I was not able to find. Then I bought it from my hometown and gave it to her. She is now
Yeah.
fine. I
So
wanted
now
to
your
share.
kid is 7 years.
My son is 10 years. My daughter is now 6 and 7 years. So
So even to them, you can give this Anutel 2 to 3 drops, no problem.
yeah,
You can,
okay.
you can say your son and daughter also, they can
Mm.
start using it. So they will be finding it very, not only just because of prevention from allergy, but it will have a lot of other benefits.
Yes. Yeah.
So
So we are giving this black pepper honey to them in a very small quantity.
yes,
Mm,
yes, yes.
and this,
Black pepper is
uh,
one pinch is enough,
yes,
because more quantity will create lot of difficulty.
yes. Anutil, I put once. After that, I not tried. I had doubt that children can that give some irritation. So I afraid. Now after you said, I
No, no.
feel
See,
so
what happens is
confidently.
when we are not used to put oil in our nose, initially for 3 4 days, you will feel some discomfort.
Mm.
But once you are using it for 3 4 days, then you will find it very easy and very comfortable.
Regularly we can use.
You regularly you can use, no problem.
But my wife once she tried, she got lot of sneezes and she get afraid. She start
Initially,
using
it
it.
will happen. So initially, it may happen, not to all, but very few people. Initially, it happens that they will put something in nose and immediately they
Mm.
will start sneezing, some secretions, etc. But once they will continue for few more days, it
Okay.
will all the symptoms will be resolved.
Okay. Thank you very much, doctor. And nice to hear from you always. And we get lot of tips to maintain our health.
So, sir,
So I
my
took
pleasure,
lot of
sir.
your
Welcome,
time.
sir.
Thank
Sir, my pleasure.
Sir, namaste, doctor.
Sir, namaste.
Rangana, sir, how are you, doctor? Hello.
Sir,
Hello.
please, sir.
Is my voice audible, sir?
Yes, sir, very clear, sir.
Yes, sir. I have a small doubt, sir. If you permit me, I put forward, sir.
Please, sir.
Yeah, during that Corona the virus pandemic period, I used to sanitize my house, sir, bedroom, and hall, and other things.
Uh-huh.
After a few days, I found myself getting the sneezing, sir.
Yes, sir. Yes, sir.
Yes, yes, sir. Yes, that is it also cause for this sneezing and allergic, sir?
Yes, sir. So that means if the allergy simply means that for many of the people it will not be a troublesome.
Yes,
but for one or two people it will be troublesome. So like the dust which is there, you are cleaning the dust, but your wife, your children may be comfortable with that, but you start sneezing.
Yes, sir. Yes, sir.
That means you are a bit sensitive to that dust. So it can be simply, you can the best thing is you avoid. So you can avoid it if like you have, it is compulsory for you to clean it. So you can wear the mask which will cover your mouth and nose both. That mask you can use, and with this you can avoid to some extent.
Yes.
Or like when you are clean it very slowly so that the dust should not come to the air and it should not.
Just it is a spray, sir. It is a spray. I put because of this COVID-19 pandemic. Yes, sir. Yes, sir. I do it, sir. Wearing mask usually, I do. And then one more doubt, sir.
Please, sir.
Yeah, whenever I take lemon rice, and immediately my nose will be blocked, sir. Lemon rice.
Okay. So actually, the lemon rice, it is sour in taste. So that may be a little bit creating difficulty for you.
Yes, sir.
And I think only in few seasons it may be creating, not always. Because some of the season you will be comfortable, but some of the season you may be feeling bit difficulty having lemon rice.
Yes, sir. Only continuous sneezing for period of 1 minute, getting 5 or 6 times sneezing. Then I come to normal. Avoid that lemon, sometimes fruit also.
Yeah. It may be, sir. Actually, some of the people, like I have seen some of the people, they are allergic to this tomato rice. Once they will have tomato rice, immediately they will start sneezing and all.
Yes.
The very simple thing is we have to avoid, or we have to minimize consuming it.
Yes, sir. I did it, sir. I did it. Avoided taking lemon rice. Then
if we little bit observe, we will also be able to identify like in what particular condition it is creating, which season it is creating more trouble. So that way we can even like sometimes we can have it in some with some limitations.
Good, sir. Thank you. Thank you, sir. I do follow, sir. I do follow. Thank you very much. I will get answer. I share this with my friends and colleagues also, sir.
Please, sir. My pleasure.
Thank you, sir. Okay, bye, sir. Bye, sir. Bye, sir. Bye, sir.
So if any of the participants
Doctor,
please.
am I audible to you, doctor? I'm JV.
Yeah, please. Yes, sir. Your voice is clear, sir.
Okay. Well, one short question. What is the solution for this eye shiners?
Yes, sir. Sir, actually the solution is the eye shiner is because of the allergic condition. So avoiding to the allergy, that will solve this problem also. So, whatever the causative factors, if you are able to identify that is creating this allergic rhinitis, so that avoiding that factor, that will solve your problem.
No, what I'm referring is eye shiners. Below the eye, dark areas should be there. In such case, I mean, what is the simple solution to follow Ayurvedic wise?
No, if you are talking like when there is no allergic rhinitis, only the dark patch around the eyes or below the eyes is there. If that you are asking,
Yes, only the dark areas.
So actually, in I think some of the session we have discussed about some herbal face pack.
Okay.
So some of this herbal face pack, like it should be simply made up of Rakta Chandan, Manjishtha, and this Masoor dal, that is lentils, the powder. So mixing all those things, you can prepare a paste. And if your skin is oily, so you can go for honey. If your skin is dry, you can go for the creamy milk. Or if you have normal texture of your skin, then you can use some rose water or simple water also. Make paste and apply around the eyes. So that will gradually see the change of the skin color will take bit time. It will not happen just applying 3 or 4 days. Immediately you may not feel the normal color in the skin, but gradually it will happen. So
this sprouts of cucumber leaves, by putting that and all that, will it give any relief?
Cucumber
pieces, when you cut the
pieces,
cucumber.
That is also used. So it will have a cooling effect. Clinically, I have not tried this particular cucumber, this pieces. So I cannot say whether how much effective it is. But we have tried this herbal. We have this some skin color and complexion improving some herbs. So these herbs we are trying. So that gives result.
Thank you,
even
Doctor.
actually one oil which is prepared by Kottakkal Vedratnam, that is Kumkumadi Tailam. That you can take and you can just do very gentle massage. So that will gradually improve the color.
Okay, doctor. I will try to get that medicine and then keep using.
It is available even online. You can take it. Take from a genuine pharmacy.
No, I'm get medicines from my CGHS dispensary, central government scheme. So I think they will be able to give me this much. No problems.
Okay, sir. Then fine, sir.
Thank you, doctor. Thank you.
Welcome, sir.
Very informative, all your talks. I think we literally follow and better understanding and to keep ourselves healthy. Some of the things we may not be able to follow, but it is really giving a very good insight into the health issues. Thank you, doctor.
My pleasure. My pleasure. Thank you, sir. So, Purnima ji has written that I have observed some of the symptoms in myself. Like in the morning, I have great sensitivity in my nose, just like I have cold and there is continuous sneezing. So Purnima ji, you can start trying with this Nasya with Adutel. That will give you a result. If you just try for 2 weeks, every day after the brush, you put 2 to 3 drops of oil, this Adutelam, in your nostrils. So that will give you a lot of relief. And you have to observe like whether it is during the transition period or you have these symptoms in all the season every day. That all you have to little bit observe. And accordingly, like suppose if you have this problem only during the winter, cold or rainy season, so you can little bit shift your timings. So that way also you will not be having these very severe symptoms. So thank you everyone. Thanks for Wishing Doctor's Day. Thanks to all. So Parikshit Bhaiya, if
Thank you, Doctor.
Ji.
Akhilesh Bhaiya, it's really so nice interactive session, and other explorer and family member also explore the scale and interacted in the very healthy manner. So it's really nice session, and we like to have more word with you, but as time suggests, and let's follow the circadian rhythm also. So thank you, Akhilesh Bhaiya, for this session, and we'll meet all again on next Friday for the same session. Namaste, everybody.
Ji Bhaiya. Thank you so much. Thanks to all.